The effects of a group-based cognitive behavioral therapy on people with multiple sclerosis, a randomized controlled trial.
Is group-based cognitive behavioral therapy on multiple sclerosis patients effective in reducing depression, fostering quality of life, and psychological well-being of affected patients through the promotion of self-redefinition, sense of coherence, and self-efficacy? Randomized controlled trial was used as a study design. It is quantitative according to data, analytic according to objective, and experimental according to methodology. From the Multiple Sclerosis Clinic Center, an initial pool of 580 patients were screened and 436 were excluded because they did not meet the inclusion criteria. The remaining 144 patients were registered and allocated to the intervention or comparison group through the drawing of a card from a pack. 30 patients allocated to the intervention group and 32 patients allocated to the comparison group declined to participate, especially because of travel, family, and work reasons. The final number of participants was 41 in the intervention group and 41 in the comparison group. The intervention group was divided into 6 subgroups based on age. The group received 4 sessions over 2 months and fifth follow-up session after 6 months. People in the comparison group attended 3 informative sessions that were conducted by different therapists about stem cells, complementary and alternative therapies, and nourishment, respectively, over the same period of 6 months and in the same non medical setting. People in the comparison group were given the opportunity to have the intervention after the conclusion of the trial.
Results showed that the quality of life increased in the intervention group compared with the control at 6 months follow-up. Well-being in the intervention group also increased for males and slightly decreased for females at 6 months follow-up. Contrasts revealed an increase in self-efficacy in the intervention group at post-treatment compared with the control. And lastly, depression tended to lower, while identity and coherence increased in the intervention group compared with the control group, though the differences were not significant.
Assessment tools regarding quality of life, psychological well being, depression, identity, self of coherence, self efficacy were administered to both groups. These were done in 3 different points in time as outcome measures. The strands noted in the study were: inclusion criteria was used to ensure that the participants are homogeneous at baseline. All the requirements were verified in the patient's case sheets together with their neurologist and a psychologist with experience of running groups based on cognitive behavioral principles conducted the groups. The study used the statistics such as mean, range, standard deviation, and repeated measures analysis of variance. While the weaknesses noted were: there was no sample size calculation used in the study. The sample size also decreased over time due to familial and employment reasons. Retention percentage of the intervention group is 27%, while the retention percentage in comparison group is 66%. The original number of participants were significantly diminished because of the demands of the study. And lastly, all of the participants were recruited from one clinic. The study provides some preliminary evidence suggesting only a group based cognitive behavioral intervention. This is somewhat unreliable due to the weaknesses overweighing the strengths. Because of this reason, we as a group will not be using the said treatment. Thank you for listening.